Hi, I'm Dr. Paul at the Allentown Cat Clinic. This is Sunny. She's a stray. She is up for adoption. She's a four-month-old little girl. She and her brother were found at one of our staff members' homes, and they both need a home, hopefully together. So we're going to spay her today. And what I want to do is show you how we do anesthesia a little bit differently from most practices. So with gas anesthesia, you have to put a tube down into the trachea, which people call the windpipe, in order to get the gas anesthesia and oxygen down into the lungs. And it closes off the trachea, so if you have saliva, spit, or Lord forbid you vomit, that doesn't go down into your lungs. So this is a normal endotracheal tube. This is what most practices use. This tube would go down through her mouth, down into the trachea, and sit in there. And it has a little balloon on the end here. I'm going to show you how we blow that up. And that balloon, I don't know if this probably isn't showing up very well for the camera, but the balloon blows up and it seals off the airway. Now this can be very irritating to the trachea, so if anybody's had gas anesthesia and you wake up and your throat is really irritated, they probably put a tube down into your trachea. And in cats it's very difficult to do, and it can actually cause some damage in there, and in really, really rare cases it can tear the trachea, which is very bad thing to have happen. So we have a new thing that we use here, and actually this is taken from human medicine. This is called the VGel. V as in Victor, G as in George, E as in Eric, and L as in Larry. The VGel system for cats, and what it does is this area sits over the trachea and seals it to put the oxygen and the gas anesthesia into the trachea without actually putting the tube down into it. So this area here sits in the back of the throat and seals off the whole back of the throat, and that delivers the oxygen and gas into the trachea. It does also have a little valve here that I can use to blow it up a little bit if I need to. And right around here it blows up a little bit, just in case I need to make it a little bit bigger. So, first thing we want to do with this little girl, and she is sedated, she's not completely asleep, but she is sedated, so she's nice and relaxed and she's not going to feel me put the tube in, this is lidocaine. This is what your dentist uses to numb up your teeth if he's going to drill. We're going to numb up the back of her throat so she doesn't feel anything. So I'm going to open her mouth up and numb up the back of her throat. And actually, she is feeling a little bit, so we're going to put her on this cute little gas mask here for a moment. And give her gas this way, just to get her sleepy enough that I can put that tube in her throat without her gagging. And we don't want that to happen. So now, what I'm going to do is I'm going to take this VGel and I'm going to put a lubricant on it so that it makes it slippery, that I can put it in the back of her throat. So I'm going to use a little bit of lube here. I'm going to smear it all over. All right, little girl, how are we feeling? Okay. And we're just going to pop this in and it's going to seal the back of her throat. Ready? 1, 2, 3. Pop. And in it goes. And then we're going to hook up the oxygen. Actually, let me tie this in place first. I'm just going to tie this right around the back of her head. And a cute little bow to keep it from moving. And then this little thing that says breathe here, this is another cute little contraption that we're using. You can hear that chirping sound. Every time this little girl breathes, it chirps. And so that tells us that she's breathing. So you can hear every time she breathes, we hear a little chirp. If by any chance she doesn't breathe for 30 seconds, this little chirpy machine starts screaming at me, so that I know there's a problem to that I need to take care of, maybe turn the anesthesia down a little bit. But these are two things that we use at our practice here in order to keep your cat safe when we put them under anesthesia. Thank you for joining me.